Welcome back to TV5 News at 9, everyone. October, we know, is Breast Cancer Awareness Month, a time to really show and wear pink for a good cause. Joining us this morning, we have a breast surgeon, Dr. Ashley Richardson with Karmanos Cancer Institute at McLaren Flint. Thanks for being here this morning, Dr. Richardson.
Thank you so much for having me.
Yes, our pleasure. Absolutely. So 1 in 8 women will develop breast cancer in her lifetime. Dr. Richardson, what difference does routine screening make when it comes to survival rates?
So it's very important to know that prevention is the key, and early detection really makes a huge difference for patients. We stress screening imaging, and starting early often leads to finding cancers at a very early stage. And the earlier the cancer is found, the better survival rate. So again, early detection is really, really important for ladies.
And Dr. Richardson, what would you say is a good time for women to start that screening?
So we always look to see if patients are average risk or high risk. And for those ladies that are average risk, we typically recommend mammograms to begin at the age of 40. And we recommend an annual mammogram, so once a year. Some patients can be seen to be high risk, and sometimes that imaging will start early. But for the average population, mammogram should begin at the age of 40.
Very good. And the McLaren Flint Foundation is hosting a free breast screening event. I think that's great. What is this, event targeting towards, really?
Yeah, so we're super happy to be doing this event this year. It's the first time that we've brought it here to McLaren Flint since COVID. And it's a free breast cancer screening event where I'll be doing clinical breast exams. And we're really targeting towards the underinsured or uninsured population. However, even if you have insurance, if you don't have a primary care doctor or they may have left the area, then certainly all ladies are welcome, even men. I mean, 1% of breast cancer can be in males. And so certainly if there's a clinical concern or a worry regarding breast cancer, the event is really open to everybody, and we're really, really excited and hoping for a good turnout this year.
So Dr. Richardson, out of my own curiosity, a lot of these screenings, mammograms, what have you, we've read that a lot of people put those off from the pandemic. Is there still kind of an apprehension in getting these types of screenings?
I think we're coming away from that. I have seen patients that had imaging prior to COVID back in 2019, and it's been quite some time, a few years. So I think patients are getting back into their primary care doctors, back into their gynecologists, and back into imaging, which is super important. So I'm hopeful with patients that we're seeing that they are starting to get their mammograms and ultrasounds and getting back into preventative care, which again, for all forms of prevention and all forms of cancer, seeing the doctor and doing the imaging is very vital to early detection.
Yeah, and so at this event that you guys are holding, you're performing clinical exams, and what can women who attend really expect otherwise?
So a clinical exam, it's important to know it's a clinical breast exam, so patients will not be getting imaging at the appointment. However, after I take a thorough history and examine the patient and get an understanding for their concerns, then we can order additional imaging. So if a mammogram is warranted or an ultrasound, we do have financial support to help get the ladies that are underinsured or uninsured the mammograms done. So although they won't have imaging at the visit, they'll have a clinical breast exam and a formal assessment by myself, and then formulate a treatment plan from there.
And do we need an appointment for this, and do we need to sign up prior?
So we are asking for appointments just so we can make sure that we have the event staffed appropriately. So there is a phone number to call. It's 810-342-1757. And we're also sending out flyers and mailers, and we'll have it on social media as well to promote the event.
Dr. Richardson, anything else you would like us to know?
No, thank you for taking the time to do this. Breast cancer is very prominent, and I'm happy to be in the community to providing services. And the more that we can offer women for early screening and detection is fantastic for the community. So thanks for having me today.
Absolutely. For someone who has come from a family where breast cancer runs, I thank you for the work that you do continuously for our patients and survivors. So thank you.
Well, thank you.
Absolutely. For more information on this great event, make sure you find it by going to the hot links section on WNEM.com.